My name is Rich Buchanan. I'm the Director of Engineering at PDS Preclinical Data Systems.
Very good. Now, you just had a session you were talking about. The topic was?
The topic of my session was applying a novel approach to bioinformatics in the preclinical space.
And how did the session go?
The session went really well. I think it was very well received. I like to try to, I inject a lot of energy in this session, but I thought it was very well received. The audience, there were some very good questions on follow-up, so I'm happy I did it, and I think the audience got something out of it.
Can you elaborate on the topic a little more?
Sure. The whole takeaway of the session really was, particularly in the preclinical space, but it's applicable anywhere in the pharma world, is we need to have new approaches into how we look at data, what we do with the data, and the tools we look to analyze the data, because the old ways, and my example was in toxicology. Toxicology as a preclinical science has been reactive, not proactive, and we really need to become a proactive science to drive the business forward.
Right. Now I also see that you're an exhibitor here.
Correct? Yes, yeah, PDS is exhibiting because one of our primary products is data warehousing and data analytical tools. We're very much focused, PDS Preclinical Data Systems, so we're very much focused on the preclinical space, but we have a suite of solution offerings to allow you to warehouse and then do some very novel analytical tools that we've created in-house or we've brought partner companies into to help you look at your preclinical data. And it probably eventually that'll expand to allow what they call the translational science, preclinical linked with the clinical, but right now we're very focused on preclinical.
And your typical audience or end user?
The typical audience are there's really three people we're always looking to work with: the business, and the IT team, because we are a software company, and then scientists. Our corporate slogan is "We think like scientists think." Most everybody there, I'm an engineer by degree and by training, and that's who I am. But most everybody else there is a biologist or a toxicologist, and that really drives the product. So we're very science focused. But the audiences are pharma, bioinformatic companies, biotechnology companies, anybody doing preclinical research.
Now you're at this event. What do you think of it?
This is great. I think there's some really neat. I particularly have enjoyed the speakers. It's great to hear different perspectives. Again, I say, my day job in the office, I'm always very focused on preclinical, and so when I come here, I see a lot more of the industry. And one of the things I like about this, they tag me along to all these scientist events, and I like coming to this one because it's very IT focused, as more of the solutions, and so they tease me that this is my people here, and I find that to be very true. So I'm enjoying it a lot.
Very good. Anything else you'd like to add?
No, thank you. Other than I think we're enjoying this, and I think we'll be back next year.